This video is going to show the structures of the heart from the laboratory list in Biology 202. If you want to follow along, the pictures we'll be looking at are the SUMSA models, so the letters and numbers on your identification sheet will match up. I'm going to go through each one of the pictures in your PowerPoint that's located under Media Library, and I'll be pointing out all the structures that can be seen in that picture. So you'll have some repetition, as well as I'm going to point out any large vessels that may not appear on the heart structures list, but they do appear on your vessels list. So starting in the first picture, we're looking directly at the right auricle. The right auricle is a pouch that sits on top of the right atrium. Remember that the atrium is a chamber and the auricle is a structure, and that's how it will be designated on the exam. We will either ask you for a structure or a chamber. The other things we can see from this view are right here, the superior vena cava, which is a result of the two brachiocephalic veins joining together to bring deoxygenated blood to the right atrium. So sticker placement on these two vessels will be very important. Placing the sticker up here at the top is going to be a brachiocephalic vein. Bringing it down anywhere underneath these two brachiocephalic veins coming together is the superior vena cava. We can see a piece of the aorta coming up from the left ventricle, and we can see pulmonary trunk. We see a small piece of the right coronary artery coming down. The rest of it is sitting behind this auricle. And if you open that auricle on the model, you can see the intact coronary artery. I know this picture is sideways, so you'll just have to bear with me. We're looking at a posterior view of the heart. And to orient you, we were just over here. This is the superior vena cava. Up here is the brachiocephalic vein. This large blue vessel on the back of the heart are the branches off of the pulmonary trunk. You have the right pulmonary artery and the left pulmonary artery, remembering that they are blue. Directly beneath the pulmonary arteries, you have the pulmonary veins, and those are going to be paired vessels coming into the left atrium. The other thing we can see is the back of the aortic arch and the three branches off of the aorta, the three large branches. The first one is the brachiocephalic artery. The second branch is the left common carotid, and the third branch is the left subclavian. We can see a small piece of the inferior vena cava as well. While it doesn't have as much blue as the superior vena cava on the models, there is a ring of blue painted around the opening. This is a view looking at the left side of the heart. To orient, here's one of the brachiocephalic veins. There's the other. Over here you have the right auricle. Here's the aorta, aortic arch, brachiocephalic artery, left common carotid, left subclavian, pulmonary trunk going into the pulmonary artery on the right, which we can't see. This is the pulmonary artery on the left. You can barely see this little white streak of paint up underneath the aortic arch and the pulmonary artery, and that is ligamentum arteriosum. We see the pulmonary veins. We can see the left auricle, and we can see some structures of the coronary circulation. The left coronary artery is coming out from underneath the pulmonary trunk, and it is splitting before we can see it, but what we do see is the anterior interventricular artery coming out from underneath that left auricle, as well as the circumflex trying to wrap around, circum means around, wrap around to the back of the heart. Another disorienting view, but what we're looking at is the inside of the right atrium. We've taken that auricle and we have opened it up. Right here is the superior vena cava. This is your aorta and aortic arch. This is your pulmonary artery. And this lets us see a few structures. We see the complete right coronary artery as it wraps around to the back of the heart. This empty space is the right atrium. So how do we ask you to identify an empty space on the test? We will literally phrase the question, please identify the chamber. And then we are looking for either the right or left atrium or the right or left ventricle. Inside of the right atrium on this model, we see a small indented circle. That is fossa ovalis. That's the opening in the fetal heart that used to allow blood to mix between the right atrium and the left atrium. The other structure we can see with this is some pectinate muscle. It looks like this webbing here, and you can also see some of it here on the back of the auricle itself. In this picture, we've taken the anterior portion of the heart off so that we can see inside. So again, orienting, here's our right auricle, there's the right coronary artery, your superior vena cava, your two brachiocephalic veins, brachiocephalic artery, left common carotid, left subclavian, aorta, aortic arch, pulmonary trunk, pulmonary arteries, left auricle, and we see a speck of the pulmonary veins. Now from this view we can see into the ventricles. Dividing the ventricles is a large muscular wall called the interventricular septum. In order to determine the right ventricle from the left ventricle, we can look at the thickness of the muscle wall. The thickness of the muscle wall in the right ventricle is significantly less than the thickness of the wall in the left ventricle. So no matter what view of a heart you're looking at, that's a very easy way to orient yourself. This is your right ventricle. This is your left ventricle. Separating them is that interventricular septum. Now we also can see portions of valve as well as chordae tendineae. The two atrioventricular valves can be viewed from here. The one sitting between the right atrium and the right ventricle is the tricuspid. The solid white plastic on this model represents the tricuspid valve. The atrioventricular valves attach themselves to papillary muscle through what look like these little strings or cords called chordae tendineae. So we can follow this shredded type of plastic down to a papillae of muscle or papillary muscle, which is the specialized muscle in the ventricles that forms these large papillae or finger-like projections. Between the left atrium and the left ventricle sits the bicuspid or the mitral valve. So the solid white plastic between those two chambers is your bicuspid or mitral valve, and it has the same thing, these strings or cords going down to the papillae or the papillary muscle in the left ventricle. We can also see a small piece of one of the semilunar valves, the pulmonary semilunar valve, which sits between the right ventricle and the base of the pulmonary trunk. Here's another view of the same heart with that upper portion, the anterior portion, taken off. So if we orient, superior vena cava, two brachiocephalics, brachiocephalic artery, left common carotid, left subclavian, aortic arch, pulmonary artery, or pulmonary trunk, pulmonary arteries, pulmonary veins, left auricle, right auricle. From this view, we can see better the semilunar valves, the pulmonary semilunar valve, and now we can see the aortic semilunar valve that sits between the aorta and the left ventricle. We can also see better the bicuspid or mitral valve, and we have not a great view, but we can see that tricuspid valve as well. We have your interventricular septum, your left ventricle, your right ventricle, as well as, it's a little bit blurry, but right here is the apex of the heart. Remembering that apex means point, and that is not always necessarily at the top. The apex of a mountain is at the top, but the apex of the heart is at the bottom. This is an inferior view of the heart looking up from the bottom. And on here we can see the inferior vena cava. We see the pulmonary veins, the pulmonary artery, the end of the aortic arch, as well as we've chosen this view so that we can see a little bit more of the coronary circulation. This is the right coronary artery wrapping around behind the heart. It will branch into a vessel that's going to go down towards the apex, that is the posterior interventricular, and also it's going to join up with the circumflex, which unfortunately on this model is hidden. It should be coming around as a branch of the left coronary to meet up as soon as that right coronary branches. So what we see are posterior interventricular and a small piece of that circumflex artery. There is a rather large vein back here called the coronary sinus, and that's bringing all the deoxygenated blood from the heart muscle and delivering it to the right atrium. Yet another view, we have that right atrium exposed. There's your right auricle, superior vena cava, right and left brachiocephalic veins, brachiocephalic artery, left common carotid, left subclavian, aorta, aortic arch, right coronary artery, pulmonary trunk, pulmonary arteries, left auricle. We can see the anterior interventricular artery and the apex of the heart. So from this view, those are some of the structures that we can see.